Welcome to Brainista, the podcast exploring deep into the brain, mind, and body. I'm Adrian, and with me today is the amazing Anna.
Hello, Brainistas. Great to be back with you.
Today we're unraveling a super common, often debilitating condition, migraines, and we're asking a burning question. Could the answer be as simple as magnesium?
Right, we're not just talking about a basic nutrient. We're going to explore how magnesium deficiency might be a hidden trigger for migraines, and how you, as healthcare professionals, can use this knowledge to bring real relief to your patients.
So really, we're getting to the heart of two crucial questions today. One, for your chronic migraine patients who are already on a cocktail of meds, are they missing a simple magnesium trick? Two, if a patient walks into your ER with an acute migraine attack, could IV magnesium be a game changer?
Exactly. We will arm you with the clinically relevant science and actionable advice to confidently answer those questions and potentially transform how you approach acute and preventive migraine management. It's time to unlock the power of magnesium. Migraines are more than just bad headaches. We're talking throbbing pain, often on one side of the head, sometimes with nausea, vomiting, cognitive and emotional fogginess, sensitivity to light and sound, the whole shebang. They affect about 20-25% of women in the 15-40 years range, and about 10% of men in the SMA age group. These aren't just occasional annoyances. These are life-disrupting events.
Up to 25%? Wow, that's like if you're in a crowded doctor's lounge statistically, a few of those folks are probably battling a migraine right now, or about to. Okay, that's a little dark, but it does emphasize how common migraines are. Okay, Anna, give us the 30-second version. What does magnesium do in the human body?
Magnesium is a busy bee, involved in over 600 enzymatic reactions. Think energy production, muscle function, nerve signaling, even DNA stability. It's absolutely crucial for overall health.
600? See, my brain is already cramping from all that information. Well, I have to tell you all about my family. We are really affected by migraines. In fact, we joke that our family crest should be a giant bottle of ibuprofen. So really, I want to know the underlying science of magnesium. So Anna, now that we've set the stage, let's dig into the science. Where has magnesium popped up on the research radar when it comes to migraines?
There's growing evidence, and that's what we want to explore today. Let's start with the 2025 article Magnesium and Migraine, published in Nutrients, where Dominguez, Veronese, Sabico, Al-Dagri, and Barbagallo reviewed the available evidence on the links between magnesium and migraine. The links to the bibliography are in the description below. That study really dove into how a deficiency in magnesium ties into things like cortical spreading depression, which is CSD, vascular changes, oxidative stress, and neurotransmitter release.
Cortical spreading depression? Sounds like my mood on a rainy Monday. What's that really about?
Imagine a ripple effect in the brain, Adrian. It's a wave of electrical activity that slowly spreads across the cortex and can trigger migraine symptoms, especially auras. Magnesium seems to help stabilize the brain and prevent this ripple from starting or slowing it down once in motion. Furthermore, a 2022 publication titled Magnesium as an Important Factor in the Pathogenesis and Treatment of Migraine, From Theory to Practice in Nutrients, Domitritz and Segielska explore the relationship from a slightly different angle. Again, the link is in the description below. The researchers discuss the function of NMDA receptors in glutamate releases.
NMDA receptors sounds complex. Layman's terms, please.
Okay, picture a doorway on a brain cell. Glutamate is like a key that opens that doorway, allowing calcium to flood in and excite the cell. Now, magnesium is like a security guard, the bouncer, that normally blocks that doorway, preventing overexcitation. In migraine, low magnesium can mean the doorway is less guarded, so the cell gets bombarded with calcium, leading to problems. Let's recall that only 1% of all magnesium in the body is extracellular, and that is what we measure in a blood test, not the most reliable value for what is happening inside the cells, which is where the physiopathology of migraine is taking place. Measuring intracellular magnesium is laborious, time-consuming, and expensive. Okay, let's get practical. For migraine prevention, the sweet spot for magnesium is generally 400 to 600 milligrams per day. The RDA for magnesium is around 400 mg per day. As long as the renal function is normal, then the kidney can handle large amounts of magnesium. Recall that in pre-eclamptic women, the dose can be about 1,000 mg per hour for many hours, and is safe for both woman and the fetus.
Noted. But all magnesium is created equal, right?
Nope. Think of it like gasoline for your car. Magnesium citrate and glycinate are like premium fuel, easily absorbed by the body. Magnesium oxide is more like the real cheap stuff, less effectively absorbed, which is something I'm sure we all don't want for something like this.
So citrate and glycinate are king. What if someone's kidneys aren't running at 100%?
Good question. Impaired kidney function means you need to be extra cautious. The magnesium that the kidney are supposed to filter out may build up, which will lead to toxicity. Less is definitely more in those patients, and a doctor's guidance is a must.
Roger that. And what happens if someone goes wild with the supplements? Is there a magnesium overdose danger?
Like with anything, there are limits. Too much magnesium can cause diarrhea, skeletal muscle weakness, hypotension, and, in very rare cases, more serious heart problems. Sticking to the recommended dosage and talking to your doctor is key. Now, for those acute debilitating migraine attacks where someone ends up in the ER, IV magnesium can be a game changer.
The cavalry has arrived.
Exactly. Think of it as a rapid strike force. It is most useful for patients who can't take oral meds, have severe nausea, or when other treatments haven't worked. If someone is in the ER for migraines and is refractory to first-line therapies, IV magnesium is a must. Remember that the more magnesium the kidneys see all at once, the more they will dump into the urine and may end up with paradoxical hypomagnesemia. Better 1 dose at a time every 2-4 hours than 4 grams at once. 2 to 4 grams at once are okay for emergency use, as in prolonged QT or Torsade, but not for gradual, as in several hours, replenishment. Diet is foundational. A magnesium-rich diet can help, and it can be simple to describe to patients.
Hit me with some simple, descriptive, vivid examples that I can actually relay to my patients.
Think leafy green spinach is like a magnesium superhero. Nuts and seeds, especially almonds and pumpkin seeds, are great snacks. Legumes, whole grains, even dark chocolate.
Now you're talking.
Right? It's not about restriction, it's about addition. Diet changes alone may not be enough to eliminate migraines entirely, but they form an important piece of the puzzle and help better manage the disease, so that other therapies work even better.
Okay, Anna, I'm ready to make this information stick. What's our Brainista approved catchphrase to help us remember all this?
How about Migra-Mag?
Migra-Mag. I like it. Short, punchy, memorable. It's got a nice ring to it. So how can we use Migra-Mag to spark conversation with colleagues?
Easy. Imagine you're at the nurse's station and someone mentions a patient with a particularly nasty migraine. You can casually drop, "Hey, have they considered Migra-Mag magnesium supplementation?" It immediately flags that you're thinking beyond the usual meds.
Love it. Gets right to the point.
Exactly. Or, is there a Migra-Mag deficiency at play here? Gets them thinking about magnesium levels and potential dietary factors they might have overlooked in the treatment plan.
Migra-Mag. Solid gold. I'm already using it in my head. Thanks, Anna. Now my colleagues will think I'm a brain genius.
All right, Adrian, let's tie this all together. We've covered that migraines affect a huge portion of the population, and that a significant chunk of people might not be getting enough magnesium in their systems. The research indicates that magnesium, particularly in well-absorbed forms like citrate, can be a valuable tool for migraine prevention. And in certain acute situations, IV magnesium can offer real relief.
So what's the bottom line for all the doctors and nurses tuning in?
The evidence is increasingly compelling. Magnesium deserves a place in your migraine acute and preventive management toolbox. Be proactive. Think about magnesium supplementation, especially if other treatments aren't cutting it, or if patients prefer a more natural approach.
Mic drop. Don't just treat the symptom. Consider the root. Magnesium. It's not just a mineral, it's a migraine modulator. Thanks, Anna. Absolutely, Anna. And now for a little something we like to call Migra-Mag Minute. Time for you to start thinking about how you implement the recommendations in your clinical settings.
Absolutely. Use this Migra-Mag knowledge to start conversations with your colleagues, spark their curiosity, and make your patients' lives better.
A stellar summary, Anna, and a huge thanks to our listeners for tuning in to Brainista.
And remember, the links to the bibliography are in the description below.
Turning down the cortical spreading depression and signing off.
Disclaimer and bibliography in the description.